Hepatitis B is a serious liver infection caused by the hepatitis B virus or HBV. This virus is highly infectious and can be transmitted through contact with infectious body fluids such as blood, semen, and vaginal fluids. It is a global health concern, affecting millions of people worldwide. This virus attacks the liver, causing inflammation and damage over time. The liver is a vital organ that processes nutrients, filters the blood, and fights infections. When the liver is inflamed, it cannot perform these functions effectively, leading to a range of health issues. Most adults who get infected develop acute hepatitis B. Acute hepatitis B is a short-term illness that occurs within the first 6 months after exposure to the virus. Symptoms can include fever, fatigue, loss of appetite, nausea, vomiting, abdominal pain, dark urine, and jaundice, which is a yellowing of the skin and eyes. This is a short-term illness. Many people with acute hepatitis B fully recover within a few months, and their bodies clear the virus without any long-term effects. However, during this period, it is crucial to monitor the patient's health and provide supportive care to manage symptoms. Many people with acute hepatitis B fully recover. They can return to their normal lives without any lasting liver damage. However, it is important to follow up with healthcare providers to ensure complete recovery and to prevent any potential complications. However, some people develop chronic hepatitis B. Chronic hepatitis B is a long-term infection that occurs when the body cannot clear the virus. This condition can persist for years, even decades, and requires ongoing medical attention. This is a long-term infection that can last a lifetime. People with chronic hepatitis B need regular monitoring and treatment to manage the infection and prevent liver damage. Treatment options may include antiviral medications to reduce the virus's activity and slow the progression of liver disease. Chronic hepatitis B can lead to serious health problems. Over time, the ongoing inflammation can cause significant liver damage, leading to conditions such as cirrhosis and liver cancer. These problems include liver damage, which can impair the liver's ability to function properly. Cirrhosis, which is scarring of the liver, liver cancer, and even death. Cirrhosis can lead to liver failure, requiring a liver transplant. Liver cancer is a severe complication that significantly reduces life expectancy. It is important to understand hepatitis B and how to protect yourself from infection. Vaccination is the most effective way to prevent hepatitis B. The hepatitis B vaccine is safe and provides long-lasting protection. Other preventive measures include avoiding sharing needles, practicing safe sex, and ensuring blood products are screened for HBV. This essay will provide you with essential information about HBV, including its transmission, symptoms, and prevention methods. By understanding hepatitis B, you can take steps to protect yourself and others from this silent threat. Hepatitis B is spread through contact with infected blood and body fluids. This can happen in various ways, such as birth. A mother infected with HBV can pass the virus to her baby during childbirth. Sexual contact. HBV can spread through unprotected sex with an infected person. Sharing needles. Sharing needles for injecting drugs is a high-risk activity for HBV transmission. Accidental needle sticks. Healthcare workers are at risk of HBV infection through accidental needle sticks from infected patients. Sharing personal items. Sharing razors, toothbrushes, or other personal items contaminated with infected blood can transmit HBV. Many people with acute hepatitis B experience mild or no symptoms. Some people, however, may develop symptoms that can last for several weeks. These symptoms can include fatigue, loss of appetite, nausea and vomiting, abdominal pain, dark urine, and yellowing of the skin and eyes, also known as jaundice. Acute hepatitis B is a short-term infection. It typically resolves on its own within a few weeks or months. Most adults who get infected with HBV develop acute hepatitis B. Chronic hepatitis B, on the other hand, is a long-term infection. It occurs when the body's immune system is unable to clear the virus. This can lead to ongoing liver inflammation and damage. Infants and young children infected with HBV are more likely to develop chronic hepatitis B. This is because their immune systems are still developing. Section 5. Complications, the risks of untreated HBV, chronic hepatitis B can lead to serious complications if left untreated. Over time, the virus can cause significant damage to the liver. This can result in cirrhosis, scarring of the liver, which can lead to liver failure, liver cancer. Chronic HBV infection is a major risk factor for liver cancer, liver failure. This is a life-threatening condition in which the liver is no longer able to function properly. Death. In severe cases, chronic hepatitis B can be fatal. Section 6. Diagnosis. Identifying the virus. Understanding how to identify the hepatitis B virus is crucial for effective treatment and management. Diagnosing hepatitis B involves a simple blood test. This test is essential for detecting the presence of the virus in the bloodstream. This test looks for the presence of HBV antigens and antibodies in the blood. These markers help determine whether someone is currently infected, has been infected in the past, or has developed immunity. These are proteins that the body produces in response to the virus. Identifying these proteins is key to understanding the stage and severity of the infection. Hepatitis B surface antigen, HBsAg. This antigen indicates an active HBV infection. If this antigen is present, it means the virus is actively replicating in the body. Hepatitis B surface antibody, HBsAg. This antibody indicates immunity to HBV, either through previous infection or vaccination. The presence of this antibody suggests that the person is protected against future infections. Hepatitis B core antibody, HBsAg. This antibody indicates a past or current HBV infection. It helps in distinguishing between acute and chronic infections. Other tests. Liver function tests may be ordered to assess liver health and the extent of liver damage. These tests provide a comprehensive view of how well the liver is functioning and can indicate the severity of the infection's impact on the liver. Section 7. Treatment, managing hepatitis B. Hepatitis B is a serious liver infection caused by the hepatitis B virus, HBV. It can be acute, lasting a short time, or chronic, lasting more than 6 months. Managing this condition effectively is crucial for maintaining liver health and overall well-being. Treatment for hepatitis B depends on the severity of the infection and whether it is acute or chronic. The approach to managing hepatitis B varies significantly based on these factors, and a healthcare professional will tailor the treatment plan to the individual needs of the patient. Not everyone with HBV infection requires treatment. In some cases, the body's immune system can fight off the infection on its own, especially in acute cases. Acute hepatitis B. Most cases of acute hepatitis B resolve on their own without specific treatment. The body's immune system is often capable of clearing the virus without medical intervention. Supportive care such as rest, fluids, and a healthy diet is usually sufficient. Patients are encouraged to stay hydrated, eat nutritious foods, and avoid alcohol to support liver health during recovery. Chronic hepatitis B. Treatment for chronic hepatitis B aims to suppress viral replication, reduce liver inflammation, and prevent complications. Chronic hepatitis B can lead to serious liver issues, including cirrhosis and liver cancer, if not managed properly. Treatment options for chronic hepatitis B include antiviral medications. These medications interfere with the virus's ability to replicate, reducing the amount of HBV in the body. They are often taken long-term to keep the virus under control and prevent liver damage. Interferon injections. Interferon is a protein that helps regulate the immune system and can be effective in some cases of chronic hepatitis B. It is usually administered as an injection and can help reduce the viral load in the body. Liver transplant. In cases of severe liver damage or liver failure, a liver transplant may be necessary. This is considered a last resort when other treatments have failed, but it can be life-saving for patients with advanced liver disease. Regular monitoring and follow-up care are essential for managing hepatitis B effectively. Patients should work closely with their healthcare providers to monitor liver function and adjust treatment plans as needed. Education and awareness about hepatitis B are also crucial. Understanding how the virus is transmitted and taking preventive measures, such as vaccination, can help reduce the spread of HBV and protect liver health. Vaccination is one of the most effective ways to prevent hepatitis B. The hepatitis B vaccine is safe and effective, providing long-term protection against the virus. By staying informed and proactive, individuals can manage hepatitis B effectively and maintain a healthy liver. Regular checkups, adherence to treatment plans, and lifestyle modifications are key components of successful management. Section 8. Vaccination, the key to prevention. Vaccination is the most effective way to prevent hepatitis B infection. The hepatitis B vaccine is safe and effective. It provides long-term protection against the virus. The hepatitis B vaccine is typically given in 3 doses over 6 months. Infants should receive their first dose at birth. Catch-up vaccination is recommended for unvaccinated children and adults. Vaccination is especially important for infants, healthcare workers, people with chronic liver disease, people with HIV infection, people who inject drugs, and sexual partners of people with HPV infection. Section 9. Other preventive measures. In addition to vaccination, there are other measures you can take to prevent hepatitis B infection. Practice safe sex use condoms consistently and correctly during sexual activity. Avoid sharing needles. Do not share needles for injecting drugs. Be cautious with personal items. Do not share razors, toothbrushes, or other personal items that could be contaminated with blood. Get tested. If you think you may have been exposed to HPV, get tested and talk to your doctor. Section 10. Living with hepatitis B. Living with chronic hepatitis B requires ongoing management. This includes regular monitoring. People with chronic HBV infection need regular blood tests and liver imaging to monitor the virus and assess liver health. Lifestyle modifications. Maintaining a healthy lifestyle through diet, exercise, and avoiding alcohol can help protect the liver. Emotional support. Living with a chronic condition like hepatitis B can be challenging. Seeking emotional support from family, friends, or support groups can be helpful. Section 11. Conclusion: protecting yourself and others. Hepatitis B is a serious liver infection that can have long-term health consequences. However, it is preventable through vaccination and other preventive measures. By understanding the modes of transmission, symptoms, and prevention strategies, you can protect yourself and others from this potentially life-threatening virus. If you have any concerns about hepatitis B, talk to your doctor.